So today we'll discuss next week the BIA's presence at BIO, the big conference in America in Chicago this year. A quick slide on what we've learned about China from our China seminars, China in Your Hand, which were ran this week. Something on where we're up to on lobbying, some news from our members and some new people who we can welcome into membership, where we are in events, and then obviously time for any questions and things that you want to raise. So I hope that you can hear me. No one's sending me messages to suggest that you can't, so I shall keep going. So next week for us, obviously, is the big bio conference in Chicago. We are running the working in partnership with UKTI to run the UK Pavilion, which is Pavilion 4441. And I look forward to seeing many of you there. I know there's about 400 people going from the UK to this conference. The key thing for us is that we if you can go on mute, that's fabulous. Then makes it easy for everybody to hear. So if you join us at the Pavilion to celebrate the 60th anniversary of PMA next Tuesday between 5 and 6:30 in Chicago, we'd be delighted to see you there. And for those of you who aren't making the trip, if you are Twitter users, I could suggest that you follow us on Twitter at BIA_UK. I'm planning to do updates throughout the week from Bio and point you in the directions of the things that I think are important. So that might be a shorthand way of staying up. So this week we have 3 seminars in London, Oxford and Cambridge on China in Your Hand. And, rather than run through the whole of what went on in those very interesting seminars, I thought one slide summary of what we've learned about China might be useful. I suppose the key thing, and none of this is particularly earth-shattering, is that biotech for China is one of their 7 strategic emerging industries, and they're expecting annual growth of 20%, and it has the world's 2nd highest number of biotech patents from 2011, and they're really committed to this. What surprised me from this seminar was understanding the importance of understanding the variance in rules, in funding regimes, in the nature of the partner and the science that you got province to province, and who your partner company was, and that was very, very interesting. The IP landscape there also, you travel from China, all the seminars is changing, and they need to be a core component of the business plan. Restrictive clauses in contracts are hard to enforce, and then there's a whole host of approval rather than registration needed for some types of tech transfer. It was great to have UKTI at these events, and if you're thinking of working in China, Rona, email here on the bottom, is a very, very useful person to be in contact with and point you in the right direction. It's likely that UKTI will run some events at Bio China, and there may be opportunities for companies to use that as a way into the Chinese market. Luke Minford at Rouse also, from an IP perspective, knows a lot, and I discovered that he was brought up and lived in China for 20 years. So although he's now in the UK, he's someone who is steeped in China and knows it very well. Hard to do justice to an in-depth seminar and slide, but I think what this shows is that we've got some people who've done some thinking on this and some companies who've made a difference here, and we can put you in contact with some people if you're thinking in that direction. Maybe if I can also move on then to provide a quick lobbying update on some things that are going on. The document here on the right has been emailed to members in the last couple of days. I hope it gives you a sense of the types of things that we're doing, and is available from Antonis on email. If you've not received it, I hope you have. If you are, so do please tell me if you've not got it in membership. It gives a good sense of what we've done in terms of policy asks, updates on the biomedical catalyst, the early access to medicine scheme and SIFs, and also takes you through some parliamentary questions that have been asked in our area, partly as a result of conversations that we've had with parliamentarians at Parliament Day in January. So I think you can see how the agendas are moving on there. Obviously, the two key documents we've produced recently are the Citizens Innovation Fund document and Biomedical Catalyst Funds document, and both of those are ongoing in discussions at the moment. We also yesterday held a very interesting meeting in the House of Commons. You can see me here with George Freeman, the Government's Advisor for Life Sciences. He's wearing a black tie because he was off to Margaret Thatcher's funeral straight after this breakfast meeting. And the fellow in the middle is Jean-Jacques Bernard, who is a leading light in OSCE, which is an event, which is an organisation which is a bit similar to the TSB in the UK, but also has business bank elements to it. And he was able to talk us through what each of our countries can learn from the policy initiatives in life sciences that have taken place over recent times. We were really interested to understand more of the FCPI system, which obviously underpins our idea of citizens innovation funds. And I think we all agreed that an ecosystem approach is important, and the government tools at every stage of development can play an important role and have made a difference in France, and could make more of a difference here in the UK. So that's really our thinking there. I also attended the parliamentary launch of the Halpern Protocols by a campaigning organisation called Empower. I think if you don't know them, it might be worth checking out their website here in the bottom right-hand corner, Empower Access to Medicines. They're a campaign to raise the issue of how do patients, particularly those with terminal disease, get access to trial medicines or early access to medicines. And I suppose their core aim is to argue that the regulations that cover the way drugs for people with serious and life-threatening conditions are developed and prescribed are out of date and out of kilter with the risk profile that those people themselves are prepared to take. And the leading light, the inspiration for this campaign is a guy called Les Halpern, who's developed most neurone disease, but he's very strong advocate for this. And I've put some thoughts as to where I think this could be, how this could be useful on my blog at the BioIndustry Association. So if you're interested, there's a bit more there. We've also continued our strong and deep links with City Hall here in London. This picture is of Kit Morehouse, the Deputy Mayor, and myself, Patrick Verheyen, who runs J&J Innovation for Europe, on the balcony at City Hall. We had 200 people at a meeting there a little over a week ago. And I think why this is important is that the City Hall and the Mayor's Office are looking to ramp up the support for life sciences as part of their second-term strategy, and we would expect to see some announcements coming in the next month from them in our space. So I think it's great to have those relationships, but I think that's also likely to be translated into some practical policy. You can see members and friends, and perhaps yourself, at our pictures on the blog, and the Science Sub-Strategy Group of the local London Economic Partnership, the LEP, is important in our space, and we've got good member representation and engagement there. But I think that that's an important group that may be where ideas are coming through there. We've also worked very hard on influencing the clinical trials transparency debate. And this, as you know, is a big issue. Excuse me, I'll take a sip before we dive into this one. I suppose there's three parts to this which might be useful. We provided a briefing on the European Commission's proposals for the clinical trial regulation, where that's at and what's happening with it, and that's available on the BIA website, and Christian obviously works most closely on this. I think the point there is that it's been endorsed by Europa Bio, and we've used it to brief members of the European Parliament and Council regarding the need to protect commercially confidential information contained in the clinical trials authorisation application. If sort of a passing interest in this and would rather read a sort of made for the public article, Christian's also authored an article on maintaining Europe's attractiveness as a location for investment in research and development in a magazine called the European Files, and that's been distributed through European institutions and is a good general way into this discussion if it's not something that you do. every day as a job, and we can make sure that that's available to you if you're interested. We're also working on the policy on access to clinical trial data, and obviously this is a very, very big discussion. BIA member experts have been taking part at a policy level in the EMA clinical trial advisory groups and providing input necessary from life science companies to develop a policy. We look forward to seeing the outcomes of those advisory groups when the EMA comes up with its proposals in this area. But I think it's been important that we've been able to access expertise and allow that expertise to put its voice at this important part of the debate to inform the EMA of some of the challenges and problems in this space, particularly when you look globally and the impact of data release in one part of the globe that has on value of assets in other parts of the globe. The third part of this is that we've been working on is we've submitted a response to the House of Commons Science and Technology Select Committee, who are doing an inquiry into the trials and the disclosure of data. It was expected that there would be a panel which largely had companies and the ABPI on. Yesterday, that was delayed because of Margaret Thatcher's funeral, and the oral evidence session is now next Monday evening, and that will be available online. So if you're looking out for where this debate is going in Westminster, that might be another important thing to note or mark. I'm glad to say that in terms of members, we've had a good run, and as you can see, there are a number of new people who've joined us in recent weeks. You may have seen that 8 synthetic biology companies have joined in one go. They're the ones in the top right-hand corner of this list here: Synthase, Algenuity, Biosynth, Geneva, Vicarium, Sympronix, Oxitec, and Nanometrics. Yep. And it's likely that we'll form a new working group. Exactly the format for that we're still working through. So if you're interested in synthetic biology, you know, we're looking at how we work in this space. Obviously, an exciting area, large crossovers to the world of drug development, but also applications beyond drug development, and that's why I think they've got some particular, just particularly useful for them to get together. So that's sort of exciting for us. Also exciting for us is to welcome Johnson & Johnson Innovation, who've obviously made their play to have the European HQ of this global organisation in the UK, based out of London, and I think that's a boost for the sector. So really nice to be able to welcome them into membership as well, along with many other partners, as you can see, from Syncona, the MRC, University of Southampton, Conformetrics, many excellent new organisations joining us, and welcome to everybody. I'm sure everyone will make them feel welcome as we meet them at our events or through policy discussion. I'm always interested to see, and I've looked back at our website to see that one of the things that members, they don't always say this to me, but looking at the data, I see that people click on the website is finding out about each other. And so I thought it would be useful to just run through some of the things that are going on in the sector that I think are worthy of note, and great some successes from our member companies that is worth sharing with the community. So Chroma have advanced its novel targeted agent towards clinical development and received a milestone payment from GSK, which is great news. Prosonics got a 1.3 million grant to accelerate their respiratory medicines, and that's again through the biomedical catalyst. Heptares Therapeutics have partnered with Cubist to research new medicines targeting G protein coupled receptors, GPCRs. Peak Therapeutics raised 40 million to advance their lead cancer drugs and exploit their network pharmacology platform. Again, these raises and these developments all go to show the vibrancy of the sector. Perhaps that the challenges of some of the raises a few years ago, this is never an easy task, but suggest that there is the possibility for successes, and that's great to see. Sphere Fluidics closed a 1.6 million investment round. Reneuron have done going great guns with their clinical trial approval and working interestingly with another member, the cell therapy catapult.
Steve, could I just interrupt there briefly, if I may?
Do.
Is that a further phase 1 for Ineuron, or have they moved on to phase 2 now with their stroke therapy?
They've done the final patient cohort in phase 1, and that's been done, and they've now got their regulatory and ethical approvals for the critical limb ischemia piece. I haven't got my notes here whether I've got those. So they've done the phase 1 clinical trial. Can I come back to you, Ben, and drop you an email?
Just out of interest.
Yeah. We're also keen to see that GSK and that which we would have known as HPA, the Health Protection Authority, but now obviously part of the new organisation called Public Health England. It's always tricky when public sector organisations change their name. So HPA and now part of Public Health England have done their non-exclusive deal to develop the next generation polio vaccine. So I think there's some vibrancy around the membership. It's great to see, and it's nice to talk about them. And if people would find it useful to do some more on this going forward, then happy to rejig, and maybe we could get some people, partner with one of these people to spend a bit more time on one of these initiatives going forward. As always, I always like to flag up what's coming up in terms of what we're doing in terms of events. BIO next week is very big for us in Chicago. The week after that, we've got a bagels breakfast in Cambridge on Thursday the 2nd of May. And the week after that, the 9th of May, a hot issues curry night, getting the most out of R&D tax credits. That's something that people have talked to us about as being really important for their business, and we want to make sure that people are maximising the opportunity there. And before the end of the month, we have our next Women in Biotech networking event again on Thursday, 23rd of May. I never like to get through this call without mentioning the flagship events we've got going forward. The BIA MHRA conference on the 5th of June, I think, is going to be really interesting, in part because Ian Hudson, who will be speaking, is moving things forward at pace with regards to the development of thinking around adaptive licensing, and I think where the EMA will have got to by then, and Ian's thinking in that area, something that's well worth hearing from. The CEO Investor Forum on the 11th of July is really where the senior teams, deals, collaborations, analysis and insights are well placed. I think we've got some very interesting people who'll be able to talk you through things that they've done this year that have made a real difference in moving their businesses forward, and that's a really good chance to have a quality time with people who are very close to the types of things that you've been doing. And I remind you that the Bioscience Forum on the 10th of October is a sort of autumn chance to get together, and we've got some great keynote speakers there at the moment. Okay, so I think that's all I was planning to do in terms of presentation. We have some time now for questions, either by audio, or if you want to do it on the chat, I'm happy to take them either way round. So the floor is yours. Okay, I've counted to 7 in my head, which is my usual rule on a webinar. I take it that there are no questions from the floor. One last chance. I'll count to 7 in my head, and if not, I shall close the webinar. Thank you for your attendance, and look forward to seeing you at one of our events or engaging with you online soon. Okay, thanks everybody. I'll end it there, and have a good day. Thank you.
Thanks, Steve.